وسهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر عبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern, and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
And good morning, Radio Baladi listeners. This is Adel Mozip welcoming you to the show. Today, we're broadcasting live on Facebook, and we are also on air in Southeast Michigan. You can catch us on 690 AM if you're in the radio or online on US Arab Radio Facebook page, as well as arabradio.us. That's our website. Today is a great day. It's Friday, and we're discussing a very important topic that has been in the news for a long time and has affected our life for the past 2 years. As part of its community service and support of the local and national efforts to vaccinate the public, US Arab Radio is declaring October as COVID-19 Vaccine Awareness Month. The battle of awareness has become imperative for the success of efforts made to confront this pandemic. The campaign, dubbed as the Vaccine of Hope, aims to explain the importance of the vaccine as a vehicle for safety and normality. US Arab Radio, its digital platform, as well as its other radios such as this one, Radio Baladi, and social media will host an array of medical experts, doctors, and public officials to diffuse false information about the vaccine and also highlight its benefits and safety. We realize that you're interested in knowing the facts and your concerns of your lives and your loved ones, and invite you to follow us and participate. If you would like to participate in this program, you can call in the studio and we can get your question answered. In today's program, we are proud to host Dr. Natasha Bagdasarian, who is currently the newly appointed State of Michigan Medical Chief Executive, who was appointed by Governor Gretchen Whitmer. And she is an infectious disease specialist based from Ann Arbor, Michigan, who received her medical degree from Wayne State University School of Medicine and has been in practice for more than 17 years. Dr. Natasha Bagdasarian, welcome to the program, and sorry for butchering your last name.
That's okay. Thanks for having me on today.
My pleasure. So we'll start. Were you expecting this appointment? Obviously, with Dr. Khaldoun's, we thank her for her service to the state and her guidance throughout this pandemic.
I was not expecting this position, but I am honored to serve the state of Michigan. I'm honored to use this platform to educate people about COVID-19 and the vaccine, as well as other public health issues. And yes, it was an honor to work alongside Dr. Khaldoun. She was a fantastic leader, and I'm honored to be following in her footsteps.
Can you tell us more about yourself? Obviously, you're an infectious disease expert. You've been actually working on the state's handling of the COVID-19 first, and then now the vaccine. So tell us more about your experience.
I'm an infectious disease physician, and my area of expertise is actually in infection prevention, so stopping diseases from transmitting. And I've worked in the hospital setting for many, many years, both hospitals in Michigan as well as hospitals overseas. And very honored to be back in Michigan and serving the state in this way. for the last more than a year, I've been here working with the state on the COVID-19 testing strategy, as you mentioned. We've done some pretty amazing things with getting rapid antigen testing into schools, for example, getting them into vulnerable areas, taking care of the most vulnerable here in Michigan. And my goal as chief medical executive is to continue some of those initiatives and just do what we can to support communities.
And Doc, now people are wondering about the vaccine. Is this going to be, and before we ask about that question, we've explained it enough on this program, but I believe listeners are still confused, the difference between the mRNA vaccine and the regular flu vaccine.
So it's different technology, but I have to say, you know, when I think about the pandemic and all of the loss and all of the bad things that have come with the pandemic, the one bright spot has been the creation of these vaccines and this new mRNA vaccine technology. It's really going to change the way that we are able to manufacture vaccines, how quickly we can manufacture them. It's amazing technology, and it's being studied right now for other purposes, including things like cancer. So we're very lucky to have this technology and lucky to have these vaccines available to us so quickly. Essentially, the way the mRNA vaccines work is they are giving your body a blueprint. They're saying, watch out for this. It's almost like giving your immune system a wanted poster and saying, look for this protein, look for this virus. And then when your body is exposed to COVID, if you've already received the vaccine, your immune system is ready to go. So it's phenomenal technology. It's a little bit newer technology than our influenza vaccines, and it's actually much more effective. These are some of the most effective vaccines that we have at our disposal. And, you know, this is after hundreds of years of developing vaccines. These have really come along and changed the whole way we look at vaccines.
That's great. And everybody now is wondering, will this be an annual vaccine that we have to take? I recently took my booster, and I can't tell you myself how I am thankful to scientists and people who have been working behind the scenes to making sure that we get this vaccine out in a record time. Usually those things take years and years of experiments and then FDA approval. But we do truly appreciate the US and its medical doctors who have, in a record time, brought this vaccine forward. But are we going to be poked every year, similar to the flu?
Most likely not. You know, we're still learning so much. COVID has only been with us for less than 2 years. So we're still learning about how things are going to look in a more long-term fashion, but most likely this is not going to be a yearly vaccine. There's good data that shows that your antibody levels after vaccination tend to be relatively well sustained. And also it's different than the flu vaccine, because with influenza, we really worry about very large shifts in the virus every year. And what we have to do with the flu vaccine is we have to look at which strains are circulating on the other side of the globe 6 months ahead of time and try to predict which strains are going to come to us and then change the vaccine based on that. With COVID, even though we've had new variants, the vaccine that we have is protective against all the variants of concern at the moment. So chances are that there won't be major tweaks. There might be some minor refinement, but there won't have to be major changes the way we have to do with influenza vaccine.
That's great. And what's the status right now for the vaccine for children who are under 12?
So the advisory committee is meeting. The data is being looked at as we speak. And we're hoping by October 26th, we could have a decision. So that's the date that we're all going to be paying attention to. But even though we don't have a decision yet, we're already starting the planning. We're already starting how we're going to get vaccine, if it's approved on that date, how we're going to get vaccine rolled out, because I think it's very important that when the vaccine is approved, that we have it ready to go for parents around the state.
And some hospital networks have required the mandated vaccine, Beaumont included, my employer. What the state is doing on obviously the state level to protect health workers and others who work in health systems, in those health systems that might not have mandated vaccines?
I know that health systems across the country are looking at this right now. They all have to look at, number one, what the federal requirements are. So there are going to be some federal requirements, and then also look at what's happening on the ground and how they can best support and encourage their staff. And we're continuing to do the same. We really encourage everyone who's eligible to get a vaccine right now to get vaccinated. Our rates of vaccination were, very high. And for a while, the supply was not as great as the demand. There were so many people who wanted the vaccine and it wasn't available. And then our number of vaccinations peaked and came down. And now the supply is much greater than the demand. And so there are lots of people out there who still haven't had their first dose. And this is the time to get it. This is the time to get the vaccine, not only for you and for your health, but for the health of your community, for your family, for people in your family who may be immunocompromised, if you have relatives with cancer or other health conditions, if you have young children in your family who haven't been vaccinated yet, now's the time to really do it for them.
Now, for patients who have existing conditions and perhaps they have a health condition that their physician may not be in a position to tell them, yeah, you can take the vaccine. Are those going to be excluded? Are those going to be exempt from those mandates?
I think these will need to be made on an individual basis. If, of course, somebody has a condition where they truly cannot receive the vaccine, that would need to be addressed on a case-by-case basis. There really aren't too many things that would not allow someone to get one of these vaccines. They're really safe and effective. So the biggest group who's ineligible for vaccination right now is that under 12 age group, and it's simply because it hasn't been approved yet. But if you're concerned that you have a reason why you cannot get the vaccine, talk to your doctor, talk to someone who understands your health condition really well, and they can give you some more information on that. But generally, these vaccines are really safe and well tolerated.
Thank you for that. I have a question now about masks. And obviously, since you've been in the trenches battling COVID-19 on the state level, we want to ask a question about masks in schools. And as a school board member, school districts were slammed for issuing mask mandates by some residents. And some claimed that masks are ineffective and they actually are adverse to students and staff health. Have you came across any studies right now that were 2 years out about the effectiveness of masks and how well they stop the spread of infection?
We actually have our own data here in Michigan looking at school districts after they opened. So after schools opened, looking at those districts that had mask policies in place and those that did not have any mask guidance in place. And there's a clear difference in terms of what happened with COVID-19 case rates. So those who had no mask policies had significantly higher rates of COVID and a steeper increase. So we have data from Michigan that supports this. There's plenty of data from around the country and around the world that show that masks are effective. They're incredibly cheap. They're incredibly well tolerated. And now with masks in schools, I have a 7-year-old myself, and I hear no complaints from him about wearing a mask or from his friends. It's become something that they're very used to doing. And in fact, for picture day today, he asked me, could he please keep his mask on for picture day? So they're very used to wearing masks in the school age group. I think sometimes the people who are getting more upset about it are not the kids themselves. Yeah,
and unfortunately. But as far as, coming to knowing that outdoors, it's okay to take off your mask and indoor you cannot, obviously air ventilation has to do something with it.
Absolutely. So there are things we know that can decrease the number of viral particles that are in the air and being transmitted. And ventilation is a huge part of that. So masks are really great at what we call source control. So they stop you from putting those particles out into the air. They also offer the wearer some protection against breathing them in. But then having good ventilation and outdoor ventilation is always better than indoor ventilation. But having really good levels of ventilation also decreases the infectious particles in the air.
Thank you, Dr. Natasha Bagdasarian. We will take a commercial break, and when we come back, we will continue our discussion. So please stay tuned, and if you would like to participate in this program, you can call 248-557-3300 to ask your question. We would welcome those questions, and also we would welcome your questions on social media as well, on our US Arab Radio Facebook page that is currently streaming this broadcast. Please stay tuned, and we'll be back.
While we've been staying safe at home, scientists have been on a journey. The destination, a COVID-19 vaccine. This journey began decades ago with research into other coronaviruses. Scientists built from there with months of research and development, cooperation with other experts worldwide, and clinical trials on tens of thousands of volunteers of diverse race, age, and health status. They arrived at a safe, effective vaccine, and hundreds of thousands in Michigan have already been vaccinated. But the next step is ours. We need to get the vaccine when we can. Keep wearing masks correctly and taking precautions until we reach our destination, freedom from COVID-19, and getting back to the lives we love. Discover the facts for yourself at michigan.gov/COVID vaccine. A message from the Michigan Department of Health and Human Services. In the face of COVID-19, staying healthy is important. And now the same is true in the face of flu. Influenza has the potential to infect millions, putting lives and the healthcare system at risk. Now more than ever, getting your flu vaccine is essential. Flu vaccines are proven to be safe and effective. In a typical year, flu vaccinations prevent millions of illnesses and thousands of hospitalizations and deaths in the U.S. Everyone 6 months and older should be vaccinated this flu season. To protect our essential workers and those who are at highest risk for flu complications, such as people over 65, children younger than 5, pregnant women, and those with underlying health conditions, we need to face the flu together. Help us hit the flu head on. Get your flu vaccine to protect your community and your loved ones. Learn more at michigan.gov/flu. A message from the Michigan Department of Health and Human Services.
At Top Rehab Physical Therapy Clinic in Dearborn, we provide effective physical therapy sessions in order to limit pain and discomfort. Top Rehab provides physical therapy care for any diagnosis prescribed by a physician, and we regularly see and treat conditions such as stroke, TMJ, fibromyalgia, sciatica, joint pain, and more. We use a variety of pain management methods, including modalities, soft tissue mobilization, and therapeutic exercise. If you're in need of physical rehabilitation or physical therapy, get the highest quality health care at Top Rehab. Most insurance is accepted, and we're open Monday, Wednesday, and Friday 8 to 6, Tuesday and Thursday 8 to 5, and Saturday 10 till 2. Call for an appointment today at 313-846-0555. That's 313-846-0555. Choose Top Rehab Physical Therapy Clinic on Michigan Avenue in Dearborn. Life's too short to be in pain.
Ziyad brand. Quality products from our family to yours. Ziyad Brothers Importing offers the finest quality products, including brands like Sultan, Kraft, Nestle, Hook, Rico Picon, Donna, and many more. Ask your retailer to carry these fine products because you deserve the very best. For more information, visit our website at www.ziyad.com. That's www.ziyad.com. Ziyad, quality products from our family to yours.
And welcome US Arab Radio listeners on Radio Baladi. Today we are discussing two major topics, obviously the COVID-19 vaccine, and we have Dr. Natasha Bagdasarian, who is the newly appointed State of Michigan medical chief by Governor Whitmer. And later on, we will have a group of educators talking about the challenges that our youth are facing, especially with the recent TikTok challenges and some adverse effects of vaping in some of our schools. So Dr. Natasha Bagdasarian, we thank you once again for coming on the program. We would like to know now on the state's efforts, what is the current vaccination rate for adults? What is still the goal and the aim for the state to vaccinate folks who are over 12?
So right now we've administered more than 10 million primary series doses of the COVID-19 vaccines, as well as 263,000 third doses. That brings us to 68.3% of Michiganders ages 16 and older who've received their first dose of one of the three vaccinations. The goal, we've talked a lot about this number of 70%. And while, of course, 70% is a lovely number to think about, and getting 70% vaccinated is always something that we have spoken about, our goal is really to get as many people vaccinated as possible. And if we could get everyone who's eligible for vaccination vaccinated, that would be really, I think there's an
Sorry,
echo.
Go ahead, yeah.
If we could get everyone vaccinated who's eligible, I think that would really be ideal. The more people we get vaccinated, the more protection we have as a community. So I mentioned earlier that we're really asking people to get vaccinated, not only for themselves, but also for their community and their families. The more people who are vaccinated, the more we can have this herd immunity or protection for those who may not have the best immune status.
Can you please explain to us the phenomena with COVID, obviously that you've been on it for a number of years, why children who contract the virus are not hospitalized at the same rate that adults are?
So generally, children are healthier than adults. Generally, children don't have all of the underlying conditions that adults tend to get as they get older. So that's one factor. But I think it would be a false assumption to say that kids don't get sick with COVID, to say that kids don't have negative consequences from COVID, because what we're seeing now with so many children getting infected, there are kids who are ending up in the hospital. There are kids who are ending up with shortness of breath and making asthma exacerbations worse. And then we also have this phenomenon of MIS-C, where kids have sort of an immune response that is gone awry when they get the virus. And so there are all these things that can happen to children. So while, generally children are very healthy and robust and they do well with most viral infections, we can't say that children don't have negative effects. And so I think it's a mistake to think about we don't need to worry about the kids. I think we do need to worry about kids right now. Our case rates in kids is very high. We know that outbreaks are happening in schools. Kids are getting exposed. And the best thing we can do while we don't have a vaccine for kids is to vaccinate everyone around them.
Besides masks and prevention layers that schools are doing and trying to social distance whatever they can do in classrooms, what else, obviously in our school district, investing in also HVAC systems, air ventilation, possibly even outside classes while the weather is still warm, and taking out students for frequent breathing breaks. What else can they do to stop the spread?
I think you've really covered the main things. Getting everyone vaccinated in school settings who are eligible. So if there are kids who are over 12, teachers and other staff who are over 12, if everyone could be vaccinated to protect the kids who remain unvaccinated, that's the first step. The second step is everyone really needs to wear masks indoors. So indoors is where spread is more likely to occur. And masks, as I mentioned, they stop both the infected person from spreading virus and they offer some protection for the person wearing the mask. And then ventilation is the next piece of this. So making sure that your air turnover is happening at a adequate rate so that virus particles aren't just hanging around in the air. And then there are all the other things that we've been talking about since the beginning of the pandemic, making sure that people are washing their hands, making sure that if they're coughing and sneezing, they're keeping those secretions contained and not allowing those to spread, staying home if you're sick, so not sending your kids to school if they're sick. And then the other part of this is testing. If we can make testing even more readily available and people are getting tested frequently, that's another part of this whole strategy to keep schools and kids as safe as possible. And we're entering into respiratory virus season. So this is now the time of year where we've got spread of other respiratory viruses. So things like RSV, influenza, other coronaviruses, rhinoviruses, and we have a vaccine for influenza. So if everyone can now start getting their flu shots as well, there's less of a chance of kids getting infected with both flu and COVID, because once you have co-infection, that's when other complications can develop. And also, the more that we can keep people healthy, keep them out of the hospital, keep our hospitals open and at full capacity, the better. So those are all the things that we can do to keep kids safe, to keep communities safe.
And question, you touched on the testing. There are a number of different tests right now. There's a rapid testing, PCR, and some are more accurate than others. But which one the state is advising people to take for COVID testing if they suspect they have COVID?
All of these tests have their own roles. And definitely the gold standard is the PCR. So the PCR is the most sensitive test there is, but there are some downsides. It can take sometimes as long as 72 hours to get your test results back. And sometimes the PCR is so sensitive, it's actually picking up on cases who may not be the greatest risk of spreading. So you can test positive by PCR even after you've recovered from COVID for some time. But the antigen tests, on the other hand, are rapid. You get your results back in 10 to 15 minutes. And they're good at picking up those who are at highest risk of spreading. So those who tend to have higher levels of virus. So they all have their own individual roles. The rapid tests are great for allowing people to take action right there and then. So if you have a kid who has the sniffles and you're not sure if it's your child's allergies or if it's COVID, and you do a rapid test at home in the morning, you can make your decision about whether your kid has allergies or COVID, which is really valuable for parents. But then there are some circumstances where you would want to follow up with a PCR test just to confirm whether or not COVID has truly been ruled out. So they all have their place, but all of these tests, I think, are valuable in our toolkit to fight against COVID.
Dr. Natasha Bagdasarian, we thank you from USR Radio and Radio Bellady for being with us today and giving us these valuable information for our listeners and our listeners on social media as well. We truly appreciate the state's efforts in getting everyone vaccinated, and we join you in calling everybody who has not been vaccinated to get the vaccine to protect everybody and to end this pandemic for once and for all. Any last words?
Thank you for having me today. And I just urge everyone out there, if you haven't yet been vaccinated for COVID, please get vaccinated. If you're due for a booster shot, please go ahead and schedule that, and please get your flu shot. So thanks everyone for listening. Thank you for having me on today.
Thank you, Dr. Bagdasarian, for joining us today.